Let me talk to you about this very important space of the shoulder known as the subacromial space. Basically, the shoulder is a ball and socket joint, as you all know. So there is a gap in between the ball of the shoulder, which is the humeral head, and the roof of the shoulder, which is the acromion. And this varies quite a bit amongst people. The gap between these two depends on your posture, depend on your bone structure at birth, depends on your muscle tone, and this space contains a lot of important things, specifically the rotator cuff. So with age or with poor posture, this space decreases and the tendon there gets pinched there. The rotator cuff gets pinched in between these two bones. This is known as subacromial impingement. This might start off with some niggling pain in your shoulder, but gradually it might worsen, it might disturb your sleep, it might even restrict your mobility. And this condition is easy to treat in the initial stages. Later on, if it worsens, it might even need surgery. So initially, we can do physiotherapy, we can try injections to make sure that this condition is relieved. In case we go for surgery, in severe cases, it is done through arthroscopic surgery or keyhole, minimally invasive surgery. A tiny camera is introduced inside the shoulder joint through tiny cuts around your shoulder, and so is the cleaning instrument. So basically, gap between these two bones is increased by trimming off a bit of bone on the side of the roof of the shoulder of the acromion. At the same time, all the inflamed tissues there, the bursa, the inflammatory fluid, is all cleared off. This is known as subacromial decompression. Before you think it's just a niggling shoulder pain which should get better on its own, it is always a good idea to consult a shoulder surgeon. Make sure it is not subacromial impingement. If it is easier to treat in the initial stages with conservative means, that is physiotherapy, medication for the pain, and maybe a shot of steroid inside the shoulder. But later on, once things worsen, it can lead to disastrous complications like rotator cuff tears and whatnot.